Never disregard professional medical advice or delay in seeking it because of something you have heard on this radio station.
Assalamu alaikum. Welcome to Parenting Hour. You're tuned into Unity FM 93.5 here in Birmingham, in the heart of the city, in this cold winter weather, mashallah, that we're having. But alhamdulillah, I hope in Luton you're having good weather down there and that you're tuned into us on Inspire FM 105.1. We're coming to you today to talk about a topic, as today is FGM Awareness Day, and we know that this may be a topic that is not that suitable for a lot of young people that may be listening in. And if you find that you are in the car travelling home, or you're at home and that there is people that are tuned into this that you don't feel it is appropriate for them to hear about FGM, female genital mutilation, that maybe you should turn off or turn to another channel or listen to something else while this programme is on for this hour. We felt it is a very important topic to bring to you today, being it the day that it is, and for people to be aware of what's happening and aware of legally what's going on here in the UK in regards to this. And for some people, we understand this may be your first time ever hearing these initials FGM, and you're wondering what's that and what does it mean. But we're going to explain that today, and we have with us our two guests that are professionals and experienced to talk about this topic. We have our resident health visitor, Alice. Welcome back, Alice.
Hi, Kathleen. Assalamu alaikum to the viewers.
Well, walaikum salam rahmatullah. Welcome back. It's always great having you here. What a pleasure for us.
Thank you.
Alhamdulillah. And we also have a guest. We haven't heard her voice for a little while, but she's been on many shows in the past. Dr. Haseena Lockhat. Assalamu alaikum.
Assalamu alaikum. Assalamu alaikum to all the listeners out there. Really, real pleasure to be here on your show, Kathleen.
You're welcome. It's so wonderful having you both here, and we know that this is a topic that is important for people to know and to understand, and to be able to spread that message, because it may be not for them, but they may come across somebody at some time, a neighbour or a relative or somebody talking about this, and they're thinking, okay, I've heard about this topic on Unity FM, on Parenting Hour, and I need to pass that information. And we know this is how things pass, through word of mouth, through talking to each other, to understanding the topic, what is FGM, and what it means for people. So maybe I'll just start with that, actually, Alice, if you can explain, what is FGM? What do these three words stand for?
Right, Kathleen. FGM stands for female genital mutilation, and it comprises of procedures that involve partial or total removal of the external female genital or other injury to the female genital organ, or for non-medical reasons. So that's World Health Organization classification. It is also sometimes referred to as female circumcision. There are no health benefits to FGM, and it is recognized internationally as a human rights violation. And there are 4 types of FGM.
Okay, so a lot of information there that we need to take on board about what it is and what's happened, and you said there was different types there for different things. I don't think we have all the time today to go into it, but is this something that is widely practiced in general?
We don't widely practice, yes, in some countries, but not all over the world. We don't know where the roots of FGM have come from. It's complex, and there are numerous suggestions. Indeed, it has not been exactly possible to determine the tradition as well, which is a tradition, so we're not sure where it's come, but it does. However, justifications for FGM are that it's custom and tradition, religion, in the mistaken belief that religious requirements, so it's not religious. It's social acceptance, and especially for marriage, and hygiene and cleanliness, increases pleasure. For family honour, so to keep the family honour intact, a sense of belonging to a group, and enhancing fertility. So these are the common beliefs held with FGM.
So people that either perform this or have their young girls that go through this process, this is what they believe in. This is why they
and
want
an acceptance within the community.
Mm-hmm.
So you've got to understand the community has a big impact on individuals, and so there's a culture of that community, and you've got to embrace that culture to be part of that community. So a lot of people are unaware that actually FGM is not practiced all over the world. So people in that country will actually think it's practiced all over, and it's so discreet as well. It's not commonly talked about.
I think that is a big thing. That's probably why it's hard to know how many people are actually having it done, because not commonly talked about. Do you have any statistics around that? Haseena, I know you, mashallah, you've written a book on this, which is really good. It's talking about experts in the field, and it's really important to get that message out there. So can you inform us a little bit about those statistics?
I think, as Alice has mentioned, it's difficult to put a figure on it, but I know that, the estimations that have been done say that there's approximately 130 million girls and women worldwide who have undergone the procedure. And I think the link with Islam, which is why we felt it was important to talk about it here today, is because a lot of the countries in which the practice happens to be in countries where there's a big Muslim population. So there's this link, which is totally erroneous, that it's to do with Islam, and it really isn't. We know that it's been practiced for hundreds and thousands of years, and it comes from the Pharaonic traditions, and that's where, again, it predates Islam, it predates all the mainstream religions. And also, I think it's important to say that it's not just been practiced by individuals from who may be Muslim, from the Muslim community, but also in Judaism, in Christianity. So it's been practiced in a lot of the main religions. But like I said, because it tends to happen in a lot of African countries where Islam is the predominant religion, that's where the link is, and that's where everybody thinks it's a Muslim tradition. But if you go to Saudi Arabia, if you go to a lot of the other countries like Malaysia, they haven't heard of it. So what does that tell us? That tells us that, well, hang on, if it was an Islamic tradition, then surely in these countries it would be practiced as well. So I think it's important to understand the history of it. And I think it's really important for us as Muslims to put that record straight, that actually this is not in our name as Muslims, please, because it really isn't a Muslim tradition.
I remember hearing first about it, going back maybe 23, 25 years ago, and my girls were very, very young. They were just toddlers at the time, and I'd never heard of such a thing before, and I never came across it. And then when I heard about it, I had a conversation with my mother-in-law, and she never heard of it either. And she was, "What's this? This is not Islamic. What do you mean?" But some people, it's as prevalent in some countries, and it was because I heard of that and the shock of it that I rang her, and I was really, really concerned. And I think a lot of people are like me.
It's interesting you say that, because the way I stumbled across it was when I was at university. I read an article in, I think it was in Marie Claire magazine, about female circumcision. I was thinking, this sounds interesting. Read about it, saw that it was linked with Islam, and I thought, hang on a minute, I've never heard of this before. What's this all about? That really got me interested in it, because I thought, well, is this really an Islamic tradition, or is this something I've just not heard of? So then I started looking into it, and it was also at the time when I was doing my clinical psychology studies, and I was looking to research something, and because this was something that started interesting me, that's how I got into it as well. So like you, it was something I just happened to stumble across, and as you said at the beginning, there's going to be people listening to this program who will never have heard of this, or will have particular ideas about what it involves. So I think it's good to be talking about this in a very open way, like I said, because a recent article from, I think it was in the Independent newspaper article, suggested that Birmingham is actually a hotbed for the number of the incidents of FGM, and that's quite shocking, really. So I think it's important that we do discuss it, and that we are able to at least understand what it's about, really, especially as health professionals, school teachers, police. There's lots of professionals who need to know what's happening because of the legislation as well, which I think we'll probably move on to talk about as well in a minute.
So listeners, if you are travelling with children at the moment home in the car and you don't feel it's appropriate for them, or if you're at home with children listening in and you don't feel it's appropriate to have the radio on for them, please, it's change to another channel. We are talking about FGM, female genital mutilation. We do understand that coming out at this hour of the evening, 5 to 6 p.m. is a family time, and that there may be children around, but the information needs to get out there, because we have a lot of professionals, as just mentioned, driving home, and they need to know about this, as well as other parents who need to know about this, to get that message out there. Seeing that Birmingham is such a high, you said, instance of happening in Birmingham, I wonder what's going on here in Birmingham that's happening, and we're going to talk about, yes, that's been illegal and all of that in a few minutes. But before we do that, maybe we should talk a little bit about the health issues and more around the circumstance of why people feel that they need to have this done for their girls.
Kathleen, the health implications are horrendous for FGM. You can have FGM results in serious and sometimes life-threatening health complications. These can include pain, bleeding, infections and difficulty with childbirth. The health complications are both short and long-term, and some women live with these health complications for the rest of their lives.
And that's why, of course, you as a health visitor and midwives need to know about this, because you can imagine the emergency in a hospital coming in to deliver a baby. If the patient had it done, we need to know about it beforehand if that's the case. But of course, prevention, because this is what we're talking about, it is something.
Yeah, we have for the midwives, we have got a great service, and we've got a specialised midwife who does actually provide the training for student midwives, and they've just recently started providing it for student nurses as well, so which is great. And health visitors have the training on a regular basis. So it's just absolutely just recognise the signs and about the mandatory reporting, and we are aware. Most professionals in the health sector should be aware, but it's other professionals and other parents and the local community that probably should have some knowledge on the subject.
And hopefully that should be reassuring to those women who may have experienced FGM, because it can be quite a traumatic experience for them to have to go to a health professional if they are having complications. And I know when I was doing my research at a time, we're talking 20 years ago, at a time when it wasn't really widely understood. So a lot of these women would present to health services, and they would get looks of shock and horror from the health professionals who had never seen anything like this before. So you can imagine the kind of traumatic effects that would have on these women. Now with the training that's mandatory for a lot of health professionals like nurses and midwives and doctors, that awareness is there. So women should not be being subject to those kind of reactions, which can actually add to their trauma that they've experienced. So I think that's really, really important, that women can feel confident that health professionals will deal with them with dignity and with respect, which is what they deserve, really.
Definitely.
And it's not just the health implications which are after FGM, but it's during the procedure.
Right.
And FGM can be carried out by untrained women and non-medical, just local people. They have limited knowledge on the medical profession, the health profession, and such as tools, hygiene. So it's just not just the process after, but it's during as well. So
where are these procedures usually carried out in the UK? Where do people hear about it in the cultures? I mean, this is not an Islamic thing, and this, we know, we're trying to get that message across today, that FGM is not an Islamic concept, and we're going to come to it being maybe illegal as well. How are these procedures taking place?
Okay, so we talked a little bit before about the statistics of the number of women that are living with FGM. Now, a lot of these women have migrated to the UK, so the practice will have been done back in their home countries. Nevertheless, we do know that the girls who are being born and brought up here from FGM practicing communities some of them are at risk. Some of that, it's difficult to measure where and how often it's being done, but some of that might be FGM being practiced illegally in this country, and we know it happens, but it's very difficult to root that out, really. We also know that a number of young girls are taken back to their countries of origin, so sometimes it may be school holidays, they'll be taken back there where FGM is still practiced quite normally, and that's where it'll be done on them. So again, it's very difficult, and because with the legislation as well, it's very, very underground still. So whilst there are, we do know that it is still being carried out here, it's difficult to get people to actually come forward and talk about it. So it's
hard to know then how many are being done, and where are these people being done, do you think, in the UK, because it's so underground like this? where has it been done?
I think, like Alice mentioned before, sometimes it may well be untrained professionals that might be doing it in their homes, or obviously it's not going to be taking place in health centres, in hospitals or anything like that, because it's illegal to have this done. So we can only assume that it's happening underground, and that people are providing resources, whatever, in their own homes, or I imagine that's what's happening at the moment.
Yeah, we haven't had many prosecutions in this country, but we've had many in France.
So I don't think there's been any prosecutions in this country. It's a very sensitive issue as well. So it's not just about legislation. We need to have a multifaceted approach here when we're trying to deal with this. We need to be working with communities. We need to be working with schools. We need to be working with the police. It's got to be a joined up approach, and not one where we're just shaking a stick saying, like, this shouldn't be happening here. It has to be a holistic approach, really.
So can we just clarify the UK law on this? Because we were talking a lot about the UK legislation and the law, and I think things have changed recently. I'm not sure of the date. Was it last year that it became illegal? Time goes by very quickly for me, so it could have been the year before, but I remember that it came into law here in the UK.
It's actually been illegal in the UK since 1985.
Since 85?
Since 85. Yep. But again, because it was a practice that not many people knew about, it's not one of these legislations that, that's been widely known, really.
I need to brush up on my law. I didn't realise that since 1985.
So when we say it's illegal, it's not only illegal to perform the procedure in this country, but it's also illegal for girls to be taken outside of the UK to have it done in other countries and then to be brought back here. That is illegal, and parents can be prosecuted if they're allowing that to happen as well. And I think that's been a big change, and that's what we need to be educating communities about as well. That it's just because it's illegal, a lot of people think that it's just illegal to have it done here, but actually it goes beyond that.
So taking people outside as well to have it done, or somebody travelling.
Which was updated from the Serious Crime Act last year. So
that's where
that's
I
change.
That's the change that I heard about. So that's where it came. A lot of people were talking about that. So it was upgraded, but we still haven't had a prosecution for that yet. But you were talking about in France, there's been a lot.
In France, because France does tend to take a heavier hand on the legal side. But I think with us, we'd like to educate parents, and on a positive note, it has increased awareness on National FGM Awareness Day, so which is international. We've had many conferences, so there's going to be, I think, probably about 20 conferences throughout England, and we've also got drop-in mornings for parents to come in and have discussions. So it's raising awareness, and parents are actually getting involved from communities to discuss the issues and get support themselves from these support services that are available.
And these awareness days, do work. I actually was talking to somebody. She doesn't work here in the UK. She works abroad in Africa, some of the countries you were mentioning earlier on. And a father was wanting to bring his child for FGM, and after they working with the father and showing the procedure and what happens, he actually didn't know what it was about, and he was only being pressurised into it because of culture, but he didn't know the procedure. And from that training that they went through, he turned and started educating people against it and becoming a leader in his community to educate others. And now that whole village has stopped doing FGM as a result of this. So as a result of just one case of one father who was brave enough to come for the training, okay, what is this about, what's going on, changed the opinions of everybody else. So this is why we need to be talking about these topics here, and getting the message out here in the UK as well, because it's not just in Africa, as you mentioned earlier on, it is everywhere in every country.
Absolutely.
And
I think going back to the link that it tends to have with Islam and religion, no matter whether our imams locally in the mosques are saying, it doesn't happen in our communities and it's not our problem. Actually, if it's being done in our name, then I think as Muslims we all have a responsibility to not just educate ourselves, but to educate others. Sometimes the communities really genuinely believe it's a religious practice because that's what all they've been taught for generations and generations. In order to change that, we need our Islamic scholars to be making those noises and saying, well, actually, let's look at the evidence. And we need them to be talking about it in the mosques, in the Friday prayers, in the sermons, so that it's raising awareness. And like you said, sometimes it can just be, one person's change of attitude that can lead to a whole generation of change. So we do need to be talking about these very sensitive issues that are affecting our communities locally. This isn't an international problem that doesn't affect us. It's affecting our communities on our doorstep.
And because the world has gone so small now, of us, we travel over and back continents so easily. We all need to be aware of this. Sorry, Alice, you were going to say.
I was just going to say, it's the Islamic Sharia Council and the Muslim College and the Muslim Council of Britain have all condemned the practice of FGM within the Muslim community, and have highlighted that FGM is not an Islamic requirement, and there's no reference to it in the Holy Quran that states that the girls must be circumcised, nor is there any authentic references in the Sunnah. So
and again, I think that's because one of the practices, there's different, as Alice mentioned before, there's 4 different types of FGM. One is known as the Sunnah, so automatically people think, Sunnah, so it must be Islamic, and it's not. That's just a name that's unfortunately been associated with it, but it has nothing to do with the Sunnah practices whatsoever.
Yeah, and because one of the principles in Islam which our beloved Prophet taught us was that do not harm yourselves or others. So that just shows that harming others or harming your children in that sense, which has such health implications, can't be right.
It's really difficult for me just to sit here and just absorb all of that, because I have images in front of me as you're talking about it. Probably a lot of our listeners do as well. So listeners, we are talking about this topic because it is important. It is important to get that message out there. It's important to understand it yourself, and it's important to talk to others about it, men and women, because it's not just something that is in the women's area. Men shouldn't talk about it. Looking back on that example of this person in Africa, he was able to change, all the generations to come and his whole village. And it could be you out there hearing this today and thinking, okay, I need to speak up about this. I know of this procedure happens or did happen in families. I can make a change, and it's every little bit that counts. It's those little small actions that can all build together.
Those little discussions in the masjid, those little discussions in the home with your neighbours, that's what starts it off.
I wonder how could we increase that a bit more and help our imams to have these discussions. They might not know where to start, because it's different. It's kind of like women's arena, women's private area, women's aura that's not mentioned so much. I wonder how could we as professionals here trying to help them.
Well, I have had a discussion with my local imam, and there is this thought that it doesn't happen in Asian communities, but unfortunately I had to put him right there, but it does. So it does have an impact on Asian communities, and it is practiced in South Asian communities. So there is also training available, so which Forward provide and the local safeguarding boards provide on FGM. So if local imams did want to get some training and some knowledge on that, they could, and by all means they can have discussions with myself, and I'm not sure how Haseena feels. We're always happy to have discussions and go through things with the imam, so if anyone wants to contact us, by all means.
I think just generally in terms of things like health related issues, I think we probably need more discussions on things like that. So I think a lot of our Islamic bodies, organisations, they run conferences, they run workshops, and really we need to be getting some of these on the agenda so that these are open, they can be openly discussed and debated, and those conversations can happen. So I think again, if there are individuals who are in charge of running conferences, workshops for any Islamic organisations, come and speak to us. We can point you in the right direction. We can get people in to do workshops. So we're very, very open to that, really.
And there is some funding out there that organisations can apply for to put on these workshops if they needed to put them on. Or are these workshops free? Are the people already there providing free workshops? Yeah,
there is. You can access funding. There is funding available, such as Forward, which is in London-based charity, but they have a lot of funding which you could tap into, especially in FGM. Women's Aid in Birmingham, they do a lot of supporting work for women who've undergone FGM. but I'm sure they can signpost us as well. But we're offering services for free, so we're offering to come out in the evenings or on the weekends, which we can discuss and go through. And I've got links, I'm not sure if Haseena's probably got links as well, charities and organisations which we can request to get extra support from other health professionals.
So there's a lot of help out there.
There is, yeah.
There's a lot of knowledge out there about this topic now. We are speaking about it, raising awareness there. Somebody may just be sitting into your car now and just turned on the radio and wondering what we're talking about. We are talking about FGM. We do understand, listeners, that this may be a topic that is not suitable for every family at this time of the evening, but it is a message that we want to get out there to raise awareness, to change practices, not just for one individual, but for many individuals and many societies. And it's not just for one culture, it is affecting lots of different cultures, as we mentioned. It's affecting a lot of different religions, where many think it is also a religious requirement, which is not a religious requirement, as you mentioned already. And we're going to talk a little bit more about all of this in detail when we come back after the break, inshallah. Listeners, you may want to just sit down and make yourself a drink over the break, and maybe get a pen as well if you want to jot down anything about contact numbers, etc., that we will be giving out after the break, inshallah. So please do not tune out completely, but tune back into us after this commercial break. Assalamu alaikum.
Never disregard professional medical advice or delay in seeking it because of something you have heard on this radio station.
Assalamu alaikum. Welcome back after that commercial break. You're tuned into Parenting Hour on Unity FM, and my name is Kathleen Roche-Nagi. We've been talking today about FGM. We've already explained this before the break, but maybe some of you have only tuning in now, that this may not be suitable for all the family to listen to it. If you're with young people, it may be an appropriate time now for you to change the channel to something else or to turn off the radio. But we still feel it's an important message to get out there for men, women, professionals and non-professionals to know about what is this and how it is affecting our community. And we've been talking a lot before the break, and we have with us here in this studio Alice, who's our resident health visitor, and Dr. Haseena Lockhat, who is our clinical psychologist, about the implications about this. And Alice, we were going to go back about the health issues, because I think parents may not understand the health issues, because if it is happening, and it happens as culturally wise, they may think that this is important for my child culturally wise, because this is a good thing for them as they perceive it to be accepted in that culture, which I know there's a lot of work going on in different communities around that. But they may also think it's good for their health. And we talked a little bit about it before the break, but maybe you can go into a bit more about that.
So we talked about short-term, infections, we talked about bleeding. Also, the child might experience frequent UTIs, which is urinary tract infections, and long-term implications of FGM are having problems during menstruation, complications in pregnancy, cysts, scarring, and a lot of women who've had a certain type of FGM may require caesarean section at childbirth. FGM has shown to cause problems with the babies and child death. So when a woman's in labour, it might have an impact on delay the labour, and it might cause medical injury to the baby or even death. So and it can be emotionally very damaging as well on the mother and the family, the husband, the partner. Some girls and women will go on to suffer emotional distress and lots of post-traumatic stress, which will bring all that back, the memories back from when they had FGM.
And we're talking here, when you mentioned about girls, just to clarify, we didn't clarify the age that this is done. Do you know what age it's generally performed?
Again, it tends to vary depending on which cultural group they're from. So it can vary from anything from, I know when I did my research, we're talking about, in some cultures it's done to babies, and in other cultures it's done to women just before they get married. But I think in this country it's estimated that the age ranges tend to be between well, I know that Birmingham and Solihull Women's Aid said that the age ranges of women that they get presenting to their services tend to be from about 17 to kind of mid-40s. But that may well be because younger girls aren't presenting because the parents know that it shouldn't be being done, or that they don't know about services that are available. But if we know that there are girls that are being illegally circumcised here, there are going to be huge psychological issues potentially that they're facing. So, for example, Alice mentioned some of the physical complications. So if you imagine that in some of the more extreme cases of FGM, we're talking about huge difficulties, even just going to the toilet, passing urine. So imagine these girls at school needing to go to the toilet. What would usually take anyone else a couple of minutes to do might take these girls a lot longer because of their physical the condition that they're in. So imagine as a child, if you're having to keep going to the toilet, how are you going to cope with something like that? What are you going to tell your friends? What people are going to be thinking? So not only have you got the psychological repercussions from physical problems, but then again, as Alice mentioned, there's the trauma of how was it carried out, if there was no anaesthetic used, which sometimes we know happens, or if the girls were not told what was going to happen and they found themselves this happening to them and their parents were aware of it, that sense of betrayal, what's that going to do to them as well, in terms of emotionally, when they find out that part of their anatomy has been taken away from them. How on earth do they make sense of something like that? So psychologically, it's very difficult to measure, how it's going to affect people. But there's lots and lots of symptoms that young girls can present with, really, like anxiety, withdrawn behaviour, just feeling very different to other people, and just knowing where they can vent some of these things is potentially going to be very difficult for them.
And that can have an impact, of course, in their whole life.
Of course it can, yeah.
And their study and what they want to achieve and where they're going to go. And
future relationships.
Yeah. And especially living in this society where, we have images of the ideal body and the ideal self. This is something that young girls are going to struggle with even more when they perhaps realise that, well, why am I not like that, or why has this been done to me? So the psychological impact of not fitting in or being different from what's regarded as normal is also potentially going to have lots of implications as well.
Oh, that's really difficult, because we were looking, when you were talking there, we were thinking of the health. It's in a way easier to understand that. And it could have probably even wider implications, because if you can't go use the toilet, you're probably not even drinking because you're afraid you don't want to go, and then you become dehydrated and maybe other health problems. But we forget the impact, the whole psychological situation. And more, it must be really difficult for these young girls. Is there somewhere that they could go to talk to this if it's happening? Where could they go?
Again, I mean, this is where it becomes very, very difficult, because those who would know that the practice is illegal may be fearful that, well, if I go and tell someone, and my parents are going to get into trouble, and so there's all those issues. But I know from the time when I carried out my research, I was actually looking at the psychological effects of this practice, and one of my theories was, well, clearly not all women who have undergone FGM are traumatised, because most of them are functioning very, very well. But from the research I did, there was a difference between those that coped with it and those that didn't cope with it. Those that didn't cope with it tended to be the ones where it had been sprung on them and they didn't know what was going to happen. I should say that all the women that I interviewed in my research were from FGM practicing countries, had been mutilated from their home countries, and then were living here as immigrants afterwards. So there was nobody that had been circumcised who was born and brought up here. So because most of them had been had it done in their home countries where it was the norm, to them it was normal. And you know, in many cultures there's a whole ceremony and parties are held where, you know, it's seen as a rite of passage, and they're given gifts and parties, and this kind of almost makes up for the trauma they go through. So that helps them to cope with it, because everybody's had it done. It's part of their identity. And in some of these countries, those women who weren't put through it because their families, for whatever reason, didn't want them to be put through it, they felt, oh well, we're missing out here, you know, we want to be part of it as well. So you can see how that support network where you're part of what's going on is a huge cushion in preventing against psychological trauma. Now if we think about those girls who were born and brought up here, who aren't going to have that around them, that cushion of support around them, because it's not the norm here, and because it's not talked about, it's really difficult to know how these girls are coping. I guess my advice would be to any listeners out there who might be struggling with some of these issues at the moment is, you know, talk to your teachers, talk to your school nurses, because they will have had training on this. They'll be able to, you know, advise you of where you can get this support, and it, you know, support is out there if you do, you know, if you do need it.
And it could be an adult as well, that maybe even a mum that she might have had a few children, but now after listening to this programme thinks, okay, that's what I had done. That reminds me, or you're bringing up memories of what happened to me when I was a child. Where would they go to? What's out there for them?
And again, you know, there are counselling and support services out there. Mainstream counselling, again, health professionals should be aware of this practice. There are in places like London, Bristol, Birmingham, there are FGM support services which are available as well. So again, it's asking for that support and help. Asking your GP.
So first port of call would be your GP, or if you've got a health visitor who's visiting, speak to your health visitor, or if you're pregnant, speak to your midwife. So, but your GP is first port of call, and they can signpost you to services.
So we've been talking quite a bit on the show, and we're coming towards the last about 10 minutes of the show. We're talking, listeners, about FGM if you've just tuned in, and it can happen from any age, from very young babies up to adulthood, up to 18 years old and older, again prior to marriage. And we have our resident health visitor here, Alice, and also Dr. Haseena Lockhat, trying to give us information around this and why it happens. And I must say it's quite new to me, and there's a lot of shivers going down my back as they're talking, but I feel that it's important for us to talk about this topic, to get the information out there so that you as listeners can actually help people about the situation and help them to form support groups, because there's not much groups or things happening here in the UK. Is that right at the moment? Is there much support groups for people that have had it done, do you think?
Some communities have a range, especially in London, I would think. But in Birmingham, I've not come across any.
I think what tends to happen is you get community groups that come up who do, you know, who apply for funding, do some really, really good work. Funding dries up after 2 or 3 years, and it all goes quiet. But that's not to say that there's not good work happening. I know that in Bristol, there's been some good work that's happened in the past and still now in Manchester as well. So these are the kind of hotbeds where we know this practice is particularly predominant. So Bristol, Manchester, Cardiff, London, Birmingham. But I think because of the sensitivities around it, people are reluctant to come forward, and I think that's where we're kind of trying to encourage women. If you're wanting help and support, and we will give out some helpline numbers at the end, but by all means approach us. You know, email the programme. You know, get in touch with us. We can help you if you're not wanting to go to mainstream services. You know, perhaps we can provide you with other support that we know of, community support that might be available.
And that email address is studio@unityfm.net. So if you are wanting to help others, or wanting to find out more about it, or want to clarify anything that came out in today's show, please do email studio@unityfm.net, or ring 0121 7728892, and the studio manager will pass on any messages in confidence to our guests who are professionals and be able to offer further support in what you may need or help in others. And it's not somebody that actually has gone through it themselves that need to take that first step. It could be anybody listening in today that feel I want to help these women, that what has happened to them, and initiate something.
And I think just picking up from that, I think especially a message to any young children, adolescent, young girls who might be suffering with repercussions of this and just not know where to go to. There is lots of help available. There's lots of therapeutic approaches we can use to try and help you to manage your symptoms that you might be experiencing. So again, if you're struggling out there and suffering on your own, please come ask for help, because there is help out there, and there's help which can be very effective as well. There's cognitive behaviour therapy, which can be quite helpful for girls and young people who might be suffering from any kind of anxiety issues or post-trauma type symptoms that they might be experiencing. But the first step is coming and asking for help.
And they may not associate this with the FGM.
That's
it may be this may be happening to them, but they're not linking it back, and that's where therapy will help them also.
Absolutely. And again, this is where teachers and anybody else who might be thinking that perhaps this may have happened to a young girl that they're noticing is presenting with any kind of emotional or psychological issues, again, come and speak to us, and we can hopefully signpost you in the right direction. Adolescence is difficult at the best of times, and we know that a lot of young people, especially from the Muslim community in general, struggle with identity issues and all sorts of things, and parents might be experiencing not just what's termed the usual adolescent behaviours here, but things like eating disorders, self-harming, and all those kind of issues. That there is help available for those kind of issues as well, not necessarily to do just with FGM, but generally, there are lots and lots of services available that for young people now. But again, as parents and as members of the Muslim community, it's up to us to highlight services that are out there to help young people when they're suffering with any kind of psychological distress. So I guess that's a topic in itself, is kind of mental health in general. But I guess the message I want to give is that help is there. You just need to come and come and ask, really.
That's really good indeed. And talking about the help that's there, can you give some examples of what help is there? What help is there locally? What help is there nationally? Bear in mind that we're also broadcasted out in Luton, and we need to make sure that we get that help available for our Luton listeners that may be tuned in and want to know some information about this.
If it's an emergency and you need to contact someone, so it's 101. And then the police have got a project called Azure. I don't know if I'm pronouncing it right. So it's a FGM project, and they can be contacted on 0207 161 2888. Then you've got a forward, so you can go on www.forward.co.uk, and their number is 0208 960 4000.
And are they a specialised organisation?
They're a specialised organisation which support women with FGM. They get a lot of funding to support and hold groups and provide training, and they've got lots of literature on the website, so do access it, just tap in.
Would that be in different languages, that literature as well?
I'm not too sure about that.
I'm sure they could if they needed, that could be arranged, but I would say Forward are the group that tend to have an overview of what tends to be going on throughout the country, really, in terms of organisations that might be working on this issue.
The NSPCC have got an FGM helpline, and it's an anonymous service, 24 hours, and that's 0800 028 3550. Then you've got Chldline, which is 0800 1111. You've got Women's Aid. They in Birmingham, they run a FGM service and support groups and provide training, and that's 0808 2000 247. And then there's also the Muslim Women's Network, which is quite national, and you can contact them on 0800 999 5786.
Wonderful. There's a lot of numbers there that you put out. Some of them are 24/7. So,
and there's lots of literature on NHS, and you've got guidance on public health. The World Health Organization, and they've got a lot of literature on FGM, and a lot of these services will also have websites which you could probably tap into.
So if we were to kind of summarise everything we've talked about today and kind of round up for our listeners, and somebody is tuned in here that for the first time they've heard about FGM, can we just go over some of that again, because maybe it's a lot. If the first time you've only heard about it, you might be thinking that this doesn't happen, and they want to know what does this FGM really means. So can we just help them?
So FGM is female genital mutilation, and it's a non-medical procedure on the female genital, and there's usually we were talking about ages before. What I've come across is the most common age which I've come across is between the ages of 4 to 7 years old, but that could be in a certain areas rather than whole national picture, but it does vary across different ages. A lot of it happens abroad, but there is some intelligence that is happening in the UK. There might be some underground clinics. It's illegal in this country, and there's lots of support services out there. But if you've been through it, or if you know that there might be someone you want to discuss it with further, or you want to get the community involved to have discussions, then there's lots of services out there. But in the first instance, if you've been through it yourself and you need support, go to your GP.
We also spent some time talking about the physical health complications of FGM in terms of as for young children, physically in terms of urinary tract infections and various physical health problems that can happen, and also psychological problems that could sometimes arise from young people who are suffering from this as well. As we've mentioned before, there's a number of helplines that you can contact for further information, and the reason why we wanted to bring it on air onto Unity FM today is because of the links that this practice seems to have with Islam, and we wanted to put the record straight, really, to say this is not an Islamic practice. It is being done and linked with the religion because a number of communities that do practice FGM happen to be Muslim countries in Africa and in other parts of the world. As such, we feel that as Muslims we have a responsibility to challenge some of that, and as a community, it's all levels of the community need to take responsibility in doing that. So we would welcome imams, scholars, teachers, whoever's out there, whoever's listening, come and get information about this, so that you can speak to your congregations, the people that come to your services and organisations, and help to put the record straight, really, and help to support them if they are struggling with any of these issues.
Thank you so much for coming in today and talking about this and highlighting this on FGM Awareness Day, because we know the more we talk about something, the more people will listen and do something about it. It's probably not talked about enough in our communities. I don't think there has been a show on Unity FM. There may have been previously a show on it, but it's something that we have responsibility to do, to educate people, to help change these unhealthy customs that has kind of crept in, and people getting confused with parts of religion and culture and shame and all of this, that people are confused, and how we can change those practices to help our communities, help our women to have healthier lives, physically and mentally and
I also encourage, I think men have a major part to play in it, and I think they're part of the solution. So please do contact us, and it's not a woman's thing. I think men really do have a major oversight, and they can make a difference, and they're part of the solution.
Very important always to include them in everything, because it's going to affect them. They will have a mother first. They will have maybe a wife if they're married. Imagine the effect on that, effect on the relationships. They might be suffering themselves at home due to a disagreement in the relationship, which comes back to this, that they don't know anything about, that they are naive to it, but it actually could stem from this. So they could be the ones to actually bring it forward. And we have some very powerful men out there that do listen in, and some dynamic people that really want to take issues like this on board and try and help families and help other communities, inshallah, as well as our own communities.
Please do, get in touch.
Brilliant. Thank you so much. Thank you so much for giving up your time, both of you, for coming in today and explaining so much about this. Listeners, if you do have a question, or you do have a comment, or you do want to ask our guests anything, please email studio@unityfm.net. Put in the subject title FGM and maybe who it is for, if it is for Alice, our resident health visitor, or if it's for Haseena, our clinical psychologist. And if you want to ask a question, please do email us in. If there's a question you want to phone in, do ring in on 0121 772 8892. We want to talk about these topics as well as we talk about a lot of other topics here on Unity FM, whether to do with physical health, whether to do with mental health. They're sensitive topics, but it was the same a few years ago when we started talking about mental health. People weren't aware of this either, but by talking about and by raising awareness, we've had many success stories from that.
We have, and governments ploughed in a lot more money in mental health now the last few years. So it could be due to awareness, and people tapping in to the services.
So we hope to come back in another few years and say this same thing has happened with FGM, that actually today's programme was a start of making some changes, inshallah, in people's lives for the better. So with that, listeners, we're going to finish today's show. Thank you so much for tuning in and giving your time to listen to this. I hope, inshallah, that this will benefit some of our community or others out there that may have gone through it. And at least if we make the intention that we're trying to do something to help, that Allah will help us to continue that and to be able to make these changes, inshallah. Inshallah, do tune in to us next week when we have another show on Parenting Hour on Unity FM, inshallah. Assalamu alaikum.
Never disregard professional medical advice or delay in seeking it because of something you have heard on this radio station.